Thank you. Morning, everyone. Thank you to the committee for inviting me to present on the lessons learned from the Dietary Guidelines Advisory Committee, and I was asked particularly to comment on the methodologies that the committee used to identify topics and also for reviewing the evidence base. It was really a wonderful opportunity for me in thinking about my presentation to review some of the record of the meeting. And for those of you who are not aware, the .gov Dietary Guidelines site has a complete record of all of the minutes of our meetings, which are incredibly dense. And I remembered as I was looking through these things, editing those minutes, and I'm so pleased really that there is such a complete public record of the process, and I hope that I can, in my brief comments today, really make you aware of the systematic process and the extraordinary work of the committee. And let me thank the members of the DHHS and USDA staff who are here, because without the 70-plus folks who backed us up as a committee, we would not have been able to do the work that we had to accomplish in an 18-month period. Just disclosures, which I think are summarized in my biography. And to summarize as we begin what the task of the committee is. As you know, we're charged by the Congress to update previous dietary guidelines, the 2010 dietary guidelines, and provide science-based recommendations to DHHS and USDA on how food, nutrition, and physical activity can promote the health of the U.S. population and help reduce the burden of major, debilitating, preventable diseases and other lifestyle-related health problems, and how best to accomplish these goals at both individual and population levels. So we really have a public health model operating here. Our document was an advisory document to DHHS and USDA and served as the basis for the development of the guidelines, and I'll comment on the extent to which our document was actually translated into the guidelines at the end of my presentation today. The committee was comprised of 14 individuals, and it's important to point out in terms of the charge and federal guidelines on the committee's work that it was gender, ethnicity, and also geographically based. And it was an extraordinary group of people who really dug in and really devoted their tasks despite their incredibly complicated schedules otherwise. We were also guided by members of both DHHS and USDA, the leadership, as noted here, but as I also mentioned, at least 70 people who were staffing the various activities of the committee, including the NEL review process, and also additional members of the federal government who came in as invited speakers or provided answers or assistance with answers to questions that the committee posed. In terms of the topic that I really want to focus on, how did the committee select the topics that we addressed in the report? You need to understand that in terms of our scope in the report, we want to address food nutrition issues that really inform issues of public health concern. So as I noted before, to promote the health and well-being of the population, and we're focusing on a generally healthy population. This is not clinical practice guidelines, but also to reduce significant burden of avoidable disease in the whole population, and particularly at-risk subpopulations. And our major focus is on food groups, including the foods and beverages within each of those groups, dietary patterns, that is the totality of dietary intake, and this was a particularly important focus in the 2015 science document and also the dietary guidelines. And what the totality means is the amount and combination of foods and nutrients that are known to promote health and prevent disease, and I'll comment on that a little bit more later. We do consider nutrients, but we are not addressing the dietary reference intakes. DGAs and the DRIs are meant to dovetail with each other, but we are not focusing on changes in the DRI recommendations. Our focus really is the food-based guidelines, as I mentioned, but also in looking at food and beverage and nutrient intake in the population. We want to look broadly also at the determinants of those dietary and also physical activity behaviors into the social, the behavioral, and the environmental determinants of the diet and physical activity behavior, and also food safety. In terms of our topic selection, we want to be mindful of the fact that our target populations are Americans 2 years of age and older. Going forward, we expect the DGAs to address the entire population, but those less than 2 were not the focus of the 2015 committee. Women who are pregnant and lactating are a focus of our work, and as I mentioned, large subpopulations at risk. We want to be mindful of the fact that in our topic selection, we are updating in the case of the 2015 committee, the 2010 guidelines. We want to focus on topics that have potential impact on food and nutrition-related outcomes of public health concern. Health outcomes such as cardiovascular diseases, overweight and obesity, cancer, and so forth. Diet-related behaviors and composition quite comprehensively. And also, we want to be thinking about topics that have reasonably high likelihood of informing the policy recommendations that are so important in terms of the work of both the Department of Health and Human Services and U.S. Department of Agriculture. So we want to be thinking about topics that can inform new guidance, that is to update the 2010 guidelines, to inform revisions to current guidance, and to address urgent public health concerns, important areas perhaps of controversy, of uncertainty, of knowledge gaps, and also to identify emerging topics that may be subject matter for future guidelines. And to really get a handle and to think comprehensively about what we were doing in the dietary guidelines, our committee put forth a conceptual model that was informed by this socio-ecological framework. And it's important to understand that the focus is the center of this model, the diet and physical activity patterns and behaviors of the population 2 years of age and older. But we also wanted to look at the influences on that behavior quite broadly, as I said, from the social, behavioral, the individual, and the environmental perspective, and then to look, as the blue part of the model indicates, the outcomes across the lifespan that the improvements in diet and physical activity behavior have the potential for impacting. So healthy weight, physical performance and function, healthy nutritional status, and so forth, broad-ranging health-related outcomes. And we also wanted to think about the areas of service of both HHS and USDA, because it is so important to understand that if 117 million Americans, as we pointed out in the report, suffer currently from preventable chronic diseases, and 3/4 of our population, as we pointed out in the report, suffer from the epidemic of overweight and obesity that has been persistent for 30 years in this population, we really want to compile a set of guideline recommendations that can be translated into policy to have impact on the broad-reaching areas that these two agencies of government have responsibility for, including our healthcare system and the Affordable Care Act, prevention strategies, the National Institutes of Health, within which our research priorities are defined and implemented, and then shifting over to USDA, the enormous number of federal nutrition and food assistance programs that touch the lives of literally millions of Americans every day. So this document that the 2015 to 2020 dietary guidelines for the Americans has tremendous potential impact, and I'm really glad to see that there's a panel today that's looking at implementation of the guidelines, because to me that's the most exciting work ahead. How are we going to implement this extremely strong set of guidelines? And then to understand in terms of the work of the committee, we were guided and we formed before the first meeting of the Committee of Science Review subcommittee comprised of myself, the Vice Chair, Alice Lichtenstein, and 2 members of our committee that had served on the 2010 guidelines. So we had historical reference not only from 2010, but in fact Alice had served on an earlier dietary guidelines committee. And what our committee, or SRSC as we called it, did was to propose a process for developing relevant scientific questions and also for prioritizing them in advance of commencing our work. This was new to the 2015 process, and it was really recommended to our committee by the federal staff as a way to really expedite identifying as quickly as possible what our topic areas were, and then to formulate and prioritize the questions that we were going to be looking at. So by the time we came to the first meeting, the SRSC, in setting out the agenda, had identified the work groups that would guide the initial formatting of our topics and identification of questions. So we've identified 3 work groups, and I'll define them in a second, and to understand that these work groups were comprised of members of the committee and members of the SRSC, and the job of the work groups was to identify the topics, identify the thematic areas relating to the topics, the questions that might be answered within the context of our review of the scientific base for the dietary guidelines, and also to identify the methods that were appropriate to use for answering those questions, and to report back, as noted here, to the Science Review Subcommittee, who then looked at the totality of that work, looked at how best to organize the themes that came out of the work group process to formulate the subcommittees that ultimately were set up and that completed the work of the committee. So just to focus down on a particular work group, you can see here that each had a specified area of the dietary guidelines activities, and the task of the work group was to think about, to discuss, to work with evidence provided by the federal staff in assisting us to really look at the high-level categories that we wanted to address in our review, and to identify within the thematic area of the work group the scientific questions, a long list of questions that were important to consider, and then to really prioritize them in terms of their likely impact and the importance in terms of our understanding of key public health concerns. So again, to think broadly about the topic, to identify the wide range of questions, to prioritize them, and then to talk about the methods that would be needed to address these questions as well, so, and to then report back to the Science Review Committee so that we could think about the best way of allocating these questions and themes across subcommittees to and think about the staffing of those committees so that we could conduct our work in this incredibly intense time frame, 18 months, to complete the work. And what we decided, again, before the first meeting was to draft a set of work groups, and how we did that was to go through the 2010 guidelines. The first thing I did when I accepted the role as chairman of the committee was to read not once, but twice, the entire report of the 2010 committee. It took a little bit of time. As you know, these are huge and important documents. And I, organized in my own mind the themes, the topics, which are well organized by chapters, so it's not a mystery. And then to think about what's missing, where the gaps are, as informed in part by the comments that were made by members of the federal government as they came to meetings and helped advise and guide us and encourage us to think broadly about where the science was at this point in time and how we could best address issues of public health concern. So what we decided initially was to form work groups on environmental determinants of food, diet, and health, dietary patterns and quality, and their optimization through lifestyle behavior changes. So you see the notion of this conceptual model, the determinants of dietary patterns and quality, and also a work group to focus on foods, beverages, and nutrients and their impact on health outcomes. And I wanted to give you a sense of what came out of the meeting one, the first public meeting of the dietary guidelines. And I'll just quickly touch on each of the work groups to give you a sense of the themes and topic areas that they began to address. So in terms of environmental determinants of food, diet, and health, the committee began by thinking about the food environment, like the physical settings, media and marketing environment, and policy environment that could influence food and beverage consumption and dietary patterns and quality, the physical activity environment, the physical settings of our neighborhoods, our schools, and so forth, the media and marketing and policy environment, and recognize that there were a 2008 set of physical activity guidelines that could help inform our activities as part of the current existing expert reports that we used as one source of information to inform our process. They wanted to look at agriculture and aquaculture sustainability. That is how, what, and where foods are grown in their long-term relationship to the health of humans, Sustainability of the food supply so as to ensure a safe, high-quality food supply across the lifespan for our entire population. To look at food systems using a systems approach and looking at methods of how food is grown, produced, processed, the costs of those foods, and so forth. In fact, when Mike McGinnis spoke before the Dietary Guidelines Committee, he really encouraged us, and a member of the former member of the IOM, he really encouraged us to look not simply at health-related outcomes and food programs and so forth, but really to get into the environment of retail and agricultural systems and so forth because of their importance to all of this. And then finally, on food safety, microbial hazards, toxic components, et cetera. So you can see how broad, the thinking was and how it might be informing the development of questions. Then work group 2 was looking at dietary patterns and quality and their optimization through lifestyle behavior and change. And what I want to point out here is not only was this group thinking about what, where, and how people are eating and drinking by age, gender, and race ethnicity, so important subgroups that might be at risk, as I was noting before, but also looking at the metabolic and health outcomes of the dietary patterns, to look at also what works for individuals to adhere to healthy dietary patterns. So this group is not only looking at what determines healthy dietary patterns, but the impact of those dietary patterns on health-related outcomes, and then intervention strategies that we can use at the individual level to improve the healthy dietary patterns and also physical activity. And they were also interested in looking at some additional topics like the clustering of lifestyle risk factors. That is, that do smokers have better or poorer dietary patterns? Are they more likely to be physically active or not? And to look at emerging topics as well, like the microbiome and so forth, again, to potentially inform future research. And then work group 3 was looking at food, beverages, and nutrients and their impact on health. And I wanted to pull out some of the notes from our first meeting because I think it gets you into the head, if you will, of the work group and their thinking. And the way Alice presented it, the first work group, was in the following way, to say that this group initially, and this was true of the other work groups as well, they first, again, looked at the 2010 document and said, what did they have to say about these topics? Then what do we need to do to expand and advance and inform on the basis of current science? And so the way she presented was to say that the 2010 The committee had already arrived at some of the topics from 2010 that were unlikely to need reassessment. We probably won't have a whole lot more to say, and we'll bring forward the recommendations on increasing food, fruit and vegetable intake. The science was good in 2010, and it's only gotten better, so we're probably not going to invest a lot of time on that topic because there are other things that we want to bring into the conversation. Eating a variety of foods, heme iron, and so forth were things that the committee was happy with, if you will, and would not be reassessing at this point in time, but in fact bringing forward. The notion that fat quality is more important than quantity was identified very early on in the process, as were high priority topics like sodium, omega-3 fatty acids, particularly in seafood, fortified foods and beverages and their impact on total nutrient intake, trans fats and their sources, and so forth. And then the committee also talked about cross-cutting topics, and this was a theme within each of the work groups, and topics that really cut across issues that each of the groups were looking at. She also talked about, you again see this tiering of topics, high priority, medium priority topics like whole grains, the amount of calories from saturated fat, the recommendation from 2010 on cholesterol, a cross-cutting second-tier topics on whole grains, then some low priority areas, and then emerging areas like GMOs. So again, the tiering of topics, if you will, that the committee was doing. Long story short, the work groups spent about, I think it was 6 months or so from spring to October, decided it was time to disband and form the subcommittees. And they reported out at the meetings. They then reported to the Science Review Subcommittee. We considered the themes, the topics, the priority questions that the groups had identified, the tiers, and the work needed to actually carry out and answer the questions that the groups had identified. And we identified 5 subcommittees that ultimately completed the reviews on each of the top tier questions and prepared the final report. And these subcommittees were food and nutrient intakes and health, current status and trends, so really looking comprehensively at what we eat, the quality of that diet, the prevalence of health concerns in the population. Food pattern modeling is the area of work that was carried out by Subcommittee 1. And this is a very traditional area of the dietary guidelines work, and it was really information and subject matter that helped inform the work of the other subcommittees as well. Subcommittee 2 looked at the dietary pattern question, and particularly at dietary patterns in relationship to health-related outcomes. This was a traditional topic, but we expanded this work considerably by looking not simply at overweight and obesity as 2010 did, but looking at cardiovascular disease, diabetes, bone health, neuro and psychological disorders, and congenital anomalies as they related to the dietary patterns as well. The question broadly of what works at the individual to promote healthy dietary patterns was on the minds of SC3, diet and physical activity, behavior change at the individual level. This group looked at not only the triggers, if you will, of influence on dietary behavior like self-monitoring and eating out and household food insecurity and so forth, but also the characteristics of interventions that can improve dietary patterns and quality at the individual level. SC4 looked at food and physical activity environments, that is, what is going on in our environment that can influence the dietary patterns and quality at a population level. So we have the individual level in SC3 and the population level in SC4. Here looking at settings like schools and child care, post-secondary settings and work sites, and also looking at food access. So we've got the what works at both the individual and population level going on. And then finally, in our food sustainability and safety area, we're looking at a very traditional topic, again, of food safety, the prevention of foodborne illness, also concerns in terms of potential excess consumption in the population, and the committee chose to look at caffeine and aspartame, and then also looking a bit at dietary patterns as they relate to the promotion of health in the population, but also the health of the planet, okay? So dietary patterns and sustainability was on this group's topic as well. The work groups identified some, initial work groups identified some cross-cutting topics, so we set up some subsequent work groups and writing groups to address them and then provide that information to the rest of the subcommittees, and they were the added sugars, sodium and saturated fat work group, and the physical activity writing group. And then just to summarize our timeline, this 18 months, meeting one in June of 2013 is when we presented the initial work group, and the work groups got underway, and actually they completed their work in advance of meeting two, and at meeting two we actually presented the subcommittee format, and the groups reported out at each of the public meetings from that point on where they stood in terms of the questions that they were addressing, and also the completion of their work. We came into the public meeting number 7 with an entire report. And we reviewed the final of the conclusions and recommendations and implications statements of the committee, and voted unanimously at that point in time to accept the report. And the ability to do that, again, was not only the incredible staffing of the committee, but the interim work that the committees did between the meetings, and then the reporting out, which we were required to do. So every conclusion statement that was made in the report was publicly discussed, debated, if you will, voted upon, and then in the interim compiled into the final report, which we completed at that meeting. We did some minor editing, not to conclusion statements or any of the summary recommendations, but editing to the report itself, subsequently. And then I signed off on it and submitted it on January 28th, 2015. In just a few minutes, what I wanted to mention, since there's been some confusion about the methods used, I wanted to point out that many of the questions that we looked at were not appropriate for the NEL systematic review process. We did about 25% of our 82 questions. So bottom line, we covered 82 questions as a committee, and about a quarter of them were addressed with NEL systematic reviews. Another 35% or so were done with de novo data analyses, things that we requested from Center for Disease Control or the NHANES research group to really answer questions about, what Americans are eating, what is the prevalence of preventable chronic diseases in the population, what's the current prevalence of overweight and obesity, how are metabolic risk factors clustering within overweight, normal weight, and obese individuals, and so forth. And then one of the things that allowed us to cover the breadth that we did in our report was the use of high-quality existing reports, and things like the clinical practice guidelines that come out of the NIH and the Academy of Sciences and Medicine, which were in many cases very recent. I also had the opportunity to serve for 5 years on the overweight and obesity guidelines and the lifestyle guidelines for cardiovascular disease risk reduction, which were published just before our committee's work began. And so our SC2, which was looking at dietary patterns and health-related outcomes, could take those reports, review them, and make the decision about bringing forth those recommendations, and if need be, updating the referencing, if needed, to even add some information as part of our process. But it really allowed us to address newer topics like bone health and neuropsych disorders with NEL systematic reviews, and to address cardiovascular disease and overweight and obesity with these extremely high-quality existing reports that had done comprehensive systematic reviews of the literature with processes that, you know, obviously I as a committee member was very comfortable with and could comment upon. In terms of translation, did our report get translated into the dietary guidelines for Americans? I think the first press call I got after the report came out was, you know, from somebody who made the comment to me that, gee, there's not much new here, and it didn't seem to really translate your report very much. And I said, read behind the headlines, okay? Read behind the headlines. This is a beautiful, comprehensive report, in part because of the simplicity in which the 5 guidelines are stated and described, if you will, in 3 chapters. It is simple. It is only 3 chapters. It is simple. It is only 5 guidelines. But with very few exceptions, virtually all of the recommendations of the scientific report of the 2015 committee are covered here. You have to read the some of the appendix material, but even the call out. I would say that, you know, the call out boxes in the reports and the chapter detail really capture what the essence of the 5 subcommittees is talking about. The key elements of healthy eating pattern. It summarizes very well the work of SC1 and the common elements of the healthy dietary pattern that were identified in SC2. The shifts needed to align with healthy eating patterns, not only work of SC1, but what it takes to improve the dietary patterns at an individual level, as covered in SC2. And then in Chapter 3, everyone has a role in supporting healthy eating patterns, the work of SC3, 4, and 5, which looked at systems approaches in agriculture, that looked at the food environment and the physical activity environment and what is needed to, and what do we know about effective methods of changing the environment to improve the dietary patterns of populations, and what do we know about improving the dietary patterns of individuals and families and so forth. So I would argue that the translation, with few exceptions, was really quite comprehensive. And I guess in my 1 minute, I would say in terms of where do we need to go from here, I think it all rests in implementation. And at the beginning of, and in fact at our swearing-in session, Dr. Howard Koh, who was undersecretary at that point in time, said, you know, we have to transform our sick healthcare system into a system that embraces the dietary guidelines and really makes it shifts the paradigm to a greater focus on prevention. And that's true not only of our healthcare system, but our public health system. And there is no better document to really help inform that than the dietary guidelines for Americans. It is our guideline for 2015 to 2020. It is, with few exceptions, as I said, comprehensive of the current state of evidence that our committee put forth. And I think that is really the challenge ahead. I know it's what I will focus on in my career. And I know that it is on the minds of, you know, the leadership of both HHS and USDA. And I hope with all of the transitions that are going on in the next few weeks that things will settle down and we can really tackle, because, as I said before, so much is at stake. So many people can be impacted by them and are impacted by the dietary guidelines. But more importantly, the problems that we face as a nation, 117 million Americans with preventable diseases, overweight and obesity, and a high proportion of the population suffering from food insecurity. We really need to implement these guidelines. And with that, I'll take your questions or finish. Thank you.